Occipital calcification and celiac disease. Definition: celiac disease is an immune system disorder caused by intolerance to gluten. It is also known as celiac sprue, gluten-sensitive enteropathy, and nephropathic sprue, also known as syndromic gluten.
Hey, this is Dr. K from my medical school, and today we're going to talk about celiac disease. Celiac disease has been in the media recently because of association with a gluten-free diet and the proposed benefits of using a gluten-free diet. But a lot of times, the word celiac disease has been used inappropriately. So let's talk about what is celiac disease, just because there's a lot of confusion about it. So celiac disease is an immune-mediated systemic disorder. Basically, your body has a reaction to gluten that causes a lot of different symptoms, which we'll talk about. Now, a lot of times people have GI symptoms, but some people may not have any GI symptoms, like abdominal pain or diarrhea.
What is gluten? Gluten is a general name of protein found in wheat, rye, barley, and other cereal derivatives. It can also be found in other products like medicine, vitamin supplements, like meat, and even glue, stamp, and envelopes. Celiac disease has been associated with several neurological disorders, with a clear increase in the incidence of epilepsy compared to the normal population.
Now, let's say you get an EGD. What does the EGD show? What is seen on the EGD that would be consistent with celiac disease? Well, here's a picture of a biopsy from someone who has celiac disease. And what you see right away is, number one, villus atrophy. So villus, or the villi, are like finger-like projections that extend from the bowel that help with absorption of nutrients. In addition, you get a lot of lymphocyte cells within the interstitial tissue. So you'll see these cells in a large number within the interstitium. And finally, you'll have crypt elongation. So we have these little recesses.
Possible cause: the presence of anti-gluten antibodies in the cerebrospinal fluid and the association with the HLA class II genes suggesting that an immune reaction originating from the jejunal mucosa triggered bleeding in gluten-intolerant people can be cause of seizures and brain calcification. Symptoms: seizures, celiac disease, malabsorption, anemia, impaired vision.
Doesn't mean you don't have celiac disease. Now, what are the symptoms and signs associated with celiac disease? Well, celiac disease can make you feel pretty horrible because it can have multiple effects on many deficiencies for the body. For example, it can cause vitamin D deficiency, it can cause iron deficiency, it can also lead to poor deposition of calcium within the bones, so causing osteopenia or osteoporosis, otherwise known as weak bones. In addition to all this, you can have diarrhea, you can have recurrent abdominal pain, you can have weight loss. All these symptoms are associated with celiac disease. In addition to abdominal pain and weight loss, you can also develop just poor balance because of lack of B12 absorption to the body, developing B12 deficiency.
Diagnosis: typical characteristics of syndrome or CTR: absence of cerebral atrophy, absence of enhancement with contrast material, subcortical calcification, bilateral, symmetrical or asymmetrical occipital.
Fatigue. So all these are associated with celiac disease. Now, how do you diagnose celiac disease? Well, celiac disease is diagnosed first off by what symptoms you have, just to see, kind of what's causing this and what your symptoms could be related to. And your doctor should take a thorough history and do a thorough physical to try to assess whether you have celiac disease or not. In addition, we can get antibody studies, so an anti-transglutaminase antibody, as well as an anti-endometrial antibody. Anti-transglutaminase antibody is very sensitive, meaning if it's negative for you, it's unlikely that you have celiac disease. But an anti-endometrial antibody is very specific, meaning if it's positive for you, it's very likely you have celiac disease. Now keep in mind, many people will have IgA deficiency. It's a protein involved in your immune system. If you do have a deficiency in this protein, your antibody studies, anti-endometrial and anti-transglutaminase, will be automatically negative. So you may get false negatives if you have person with IgA deficiency. So keep that in mind. Next, if your antibodies come back positive, they'll do an EGD or upper endoscopy, taking biopsies to see if the tissue in your bowel.
Treatment. Treatment is a gluten-free diet free of wheat, barley, rye, and oats.
You'll see them elongating. So how do you treat celiac disease? Well, really just a gluten-free diet. That's also how we treat celiac disease. We avoid the trigger. Now, gluten-free diets are hard to maintain because there's a little bit of gluten in almost everything. But things to consider that are both in, that you can eat, and things you can't eat are, so you can eat meat, fish, chicken. Those are perfectly fine as long as they're not breaded or anything added to them. Fruits are okay. Vegetables are definitely okay. Again, as long as nothing's added to these. Barley and rye are two things you really need to avoid. Nuts are perfectly fine for a gluten-free diet, and then beans also are very good for a gluten-free diet. Now, other things to avoid would be like wheat. You shouldn't eat wheat or pasta, so a lot of Italian food is kind of out the window unless you can get gluten-free pastas. Cereals and French fries are also generally out for the